Private hospitals are reported to have lost their capacity to handle COVID-19 patients. This as the rising numbers continue to immensely affect the operations of county governments, leading to many shutting down their services. Zina Mohammed with the details.
John, not his real name, tells me how his efforts and that of his friends bore no fruits as they struggled from the wee hours of the morning to get their friend who had difficulty in breathing an admission to hospital. According to John, more than 5 hospitals declined to admit the COVID-19 patient.
We had that morning episode. One of our friends called us in the morning, I think 4 a.m. in the morning, trying to tell us to assist him in getting a bed in Kakamega.
Because he wanted an isolation bed?
Initially it was just basically a bed. But the patient had difficulty in breathing and the patient was in Machakos. So basically the few patients we had, we tried to call Aga Khan, because the emergency and all the possible lines. Yeah, but we were told when we described the case that he had difficulty in breathing, we were told all the isolation beds are full. In fact, to a level where there are 2 patients waiting on their waiting list, and they were already in the hospital trying to get a bed.
Wow.
So by all means, we were told you cannot be able to get a bed at that hospital and there is no need of bringing him on board.
John further says the claims by the hospital's management that private hospitals are not full are nothing but lies, as many of the hospitals they communicated with did not have any isolation beds for COVID-19 patients.
Of course, they will deny those stories, but you know the calls came through. We called, we talked to the people in the hospital, and all necessary connections are available. But that is a story. That is a story. And the people we are talking to, you know, you call the hospital, you are connected to the nursing unit in charge of the wards, and then you describe your case. You are told they are full to capacity. And those are 5 hospitals.
This is as the rising numbers of COVID-19 cases at the county level continues to immensely affect the operations in many counties. In Kakamega County, Chief of Staff Robert Sumbi succumbed to coronavirus Thursday morning. The county government has shut down its offices for 2 weeks. The county has now recorded a total of 57 county officers who have tested positive for the virus so far. In a statement to newsrooms, the Governor Wycliffe Oparanya, who is also the Chair Council of Governors, sent his condolences to the family of the deceased whilst announcing the shutdown of county operations. Bungoma County has announced the continued closure of the county government offices for another 14 days after 6 MCAs and 7 county officers contracted COVID-19.
Kubwa ambayo inatukodolea macho katika jimbo la Bungoma katika nchi ya Kenya ni ugonjwa wa corona. Tulifikiria umerudi chini, lakini tunaposikia rate ya kuambukizana imeanza kupanda tena.
Kilifi County Government has scaled down its operations following 6 officers and 24 health workers contracting COVID-19.
Kwa mwezi wa 3 tangu tutangaziwe kisa cha kwanza mpaka leo, Kilifi tumekuwa na visa 504. Na visa hivi 504 vingi vimepatikana hivi majuzi. Hivyo basi hii inaashiria kwamba idadi ya maambukizi katika kaunti yetu ya Kilifi imeanza kupanda na kupanda kwa kasi.
In Busia County, Area Governor Sospita Ojamong has blamed the national government for the delayed release of county funds, saying the delay has derailed the fight against COVID-19 by counties. Governors have now issued a warning to private hospitals against sending COVID-19 patients to public hospitals.
19 has made, people lose jobs, few people to do what was done by many people. There's a lot of stress in the workforce. Mental illness is really a major issue.
President Uhuru Kenyatta has convened an extraordinary summit on Wednesday next week in a bid to determine the way forward in the wake of a surge in COVID-19 cases in the country. Zainab Mohammed, TV 47.